Hi, I'm Rose with Be Well PBC. The Palm Health Foundation, Healthier Together Communities, and my fellow community connectors recently invited two local physicians, Dr. Michael Smith and Dr. Tiffany McCalla from the Leroy Jefferson Medical Society, to join us for a couch conversation to talk about COVID-19. We appreciate the doctors giving us straight talk about COVID-19 and how we can all stay safe. This is the second in a series of 4 videos discussing what you need to know about COVID-19. In this video, you will learn about COVID-19 vaccines. Get ready to learn more about COVID-19 and be sure to watch the other videos in this series. You can find the series on Be Well PBC's or Palm Health's YouTube channel. How long after the vaccine can an individual know whether he or she is protected?
Please expect that when you receive your vaccination, that you may have a response, okay? And you may feel kind of lousy, especially after that second dose. You may feel really lousy, like that whole day, okay? But that's actually a good thing, because that tells us that the vaccine is doing what it needs to do. It is eliciting a response of your body, a response of your body's immune system. Now, we are still learning how deep the immune response is for each of the different vaccines. But at this point, it doesn't matter, which one you get. You just need to get one so that you can have some protection. The effectiveness of the vaccines have been shown at 94 to 95%. You don't get to the full 94 or 95% until after the second dose of the Pfizer or the Moderna. But we're expecting to get to you should get about to the 94% with the Johnson & Johnson. But as Dr. McCalla indicated, it may take weeks. People have to understand, we all, although we are human and very similar, we are all very different. And we all have a different biological system that responds to different things differently. So it may take one person just 3 weeks to develop full protection, whereas it may take another person 5 to 6 or even more. We just don't know. It depends on your individual biology. And I also want to make sure that people understand is that the vaccine, you will have soreness at the site of injection, just like you do when you get the flu shot. Okay, it's going to be sore and painful a little bit, but I want you to understand what's happening when you feel lousy. Those antibodies that Dr. McCalla mentioned, you should think of them as kind of the soldiers that protect your body. Every single cell in your body has a tag on it, that tag that says self, okay? And your immune system knows that tag. So anything that comes into your body, any pathogen or what have you that comes into your body that does not have that tag, the immune system attacks it. We oftentimes don't even know that our immune system is protecting us, because we breathe in through your nose, comes in through your mouth, and sometimes through your eyes. That's why we say when you wear the mask, don't wear the mask under your nose, because you still have stuff coming out. So don't make that foolish mistake. Wear the mask over the nose, okay? But your soldiers, when they go to attack those invaders or those outside things that are not supposed to be in the body, they need energy. They need energy, just like you need energy when you go to do whatever you need. You have to eat your breakfast in the morning before you go to work. You need energy to do work. Well, those soldiers, they need energy. And so they pull energy from other parts of your body to fight off that infection. And that's why you feel sluggish, you feel down, you don't feel so good, because your soldiers are waging a battle. Now, once those soldiers have defeated the invader or is done, okay, then they release that energy and it goes back to the rest of your body, and then you start to feel better. Okay, so you probably remember that when you get, a regular common cold. Okay, that's how the body responds. So, the vaccines, they are not cures. Okay, the vaccine, what it does, it's a pharmaceutical that protects you, because like Dr. McCalla said, once the body recognizes what that virus looks like, once that virus tries to come into your body again, it will fight it off. The question is, how long do we have that protection? We still don't know that yet. Hopefully, the protection will be a long time, if not, for good. It's a possibility that it may be something that we have to take every year until it gets to a point where it's not in the world population very much. We don't know that yet. Hopefully not, because it's hard enough trying to get people to get their annual flu shot. So we hope that the protection that these vaccines provide is deeper. There are some questions about these variants. And as Dr. McCalla mentioned, that's what viruses do. They mutate to survive their environment. So, once the environment becomes unhospitable, they change a little bit so that they can better deal with it. It's just like you, when you go outside, if it's too hot outside, you take off that coat or off that sweater. Okay, you put on some shorts, put on some flip-flops. Okay, we all try to adjust to our environments to survive. So the variants that we are most concerned about, the UK variant we know about, and the Brazil and the South, but the South African strain is perhaps the one that we're most concerned about. These other strains, they are highly transmissible, which makes makes me so nervous when I see young people and older people out at public places and having parties and cookouts as if the pandemic is not even here. Because those different strains, they are here in the United States. They're here, folks. And so being that they are more easily transmitted, so we really need to cut the foolishness out, honestly. We need to cut the foolishness out, all right? We get upset when our kids don't do what we tell them to. Okay, well, as adults, you need to do what we're telling you to do as well, okay? Stay home and cut out the foolishness, all right? Because you are putting yourself, your family, and those you love at risk. So I hope this really connects with the community. And please, folks, go get your vaccination. I don't want to hear anything about the Tuskegee study and all this other foolishness, okay? This is not 1923, okay? Cut out the foolishness, all right? Go get your vaccination. I understand the concerns that Black folks, I know well. I teach this stuff in medical school. I know that Black people have terrible experiences sometimes in the medical system. I know about sometimes you go into the clinic, you don't get the best treatment. You go to the ER, you don't get the best treatment. Sometimes the doctors are so condescending as if they are all knowing and almighty. I get it. This is not the time for that kind of foolish discussion. Get your vaccination, get protected, okay? To be very blunt with you, them white folks, they running to get their shots. So you want to play around it if you want to. They are getting their shots. I can barely get into Publix because that line is so long. Okay?
Yes, they are.
Just something I was wondering, even though I really feel like I might know the answer, but does certain vaccines work better if you have an underlying condition? So like, does Pfizer work better in those people who may have diabetes, or does Moderna work better in someone who may have high blood pressure? Just, something I was wondering, just a thought. To either one, Dr. Smith or Dr. McCalla.
I'll take it, and I'll invite Dr. McCalla to speak on it. Like I said, like we both said earlier, we are still learning about these vaccines. Okay, and we still don't. There's still a lot we don't know. What I always recommend to people is to consult with your primary care physician. They are most familiar with your pre-existing conditions and your particular situation. I resist making a blanket statement for all people, because that's malpractice. You really need to check with your primary care physician and have a conversation about your personal situation and your personal health, and let them guide and direct you as to whether or not you're even a candidate for the vaccines, because some people cannot get the vaccine because they have too many pre-existing conditions, and it's just not safe for them. So, I always recommend that you have that conversation with your primary care physician. But Dr. McCalla, did you want to add anything to that?
No, well, I guess a little bit. I think that in 5 years, we'll look back and we'll have more information, but right now we just don't know. So your specific question was, is there a specific vaccine that's better for someone with hypertension or diabetes or whatever? I'm sure there probably is, and we'll know that on retrospective studies. The reality of it is, when they decide what indications they use for a vaccine or which populations can or cannot get it, that would mean ethically you would have to randomize people in or out of the trial with that specific disease. No one's doing that with COVID. We just don't have enough of a population that went in to be tested or that went in to get the vaccinations, right? So that's why when we talk about clinical trials, we talk about phase 1, phase 2, we're still in like phase 4 trials now, because everyone that gets the vaccine is reporting how they feel. So after I got my vaccine, you go back in and you list what medical problems you have, and then a couple of days later, they ask you what symptoms you're having. And then they ask you a couple of days later, have you gotten COVID-19? And so I got my first dose December 29th, like 28th, something like that. But I still get the questions. How do you feel now since you've gotten the vaccine? Have you gotten COVID? This is continuing research. So when all this stuff is compiled with the millions of people that have gotten the vaccine, we'll have a better answer. And we'll be able to do what we call the retrospective study. So we'll be able to look back, and we have enough information, and then we say, you know what? People that had hypertension and got the Moderna vaccine didn't get COVID, but people that had hypertension and got Pfizer, they did get COVID. So then the Moderna is better for hypertension people than, we don't have the information yet. It's unethical to do it that way.
Is there a percent of people who will not be able to tolerate the vaccine and die?
In terms of, are there a percentage of people who can't tolerate the vaccine and die? There's always a percentage of people who have adverse or negative reactions to vaccines, to medications. Once again, that falls into the line of research in trying to identify what the cause of that is. But yes, there's always going to be, no one likes to talk about that, because we're trying to encourage people to either take their medication or to get vaccinated. But there's always, and the good thing is, or the good news is that those persons are what we call, in biostatistics, those people are what we regard as outliers. Okay, they are outside of the majority of people who respond. The majority of people respond to the vaccines, in the way that you heard about the most. But that's not what gets talked about the most. What gets talked about the most is that one person out of millions who died. And we still don't know, and as Dr. McCalla indicated, we don't know if they died as a consequence of COVID-19 or they died as a result of complications caused by COVID-19, or may not even be caused by COVID-19, just that they died from something that came after having COVID-19. So you can see how, the facts and the research can become very convoluted. But the simple answer is that, yes, of course, there's always going to be some fallout from medications, from vaccination. That's why medications in this country go through such a scrutinizing process. We can complain, whatever side of the aisle you're on, you can complain about, federal oversight, but be thankful, that we do have an FDA that require these drugs to undergo very rigorous studies before they are released to the public. You go to some other countries and you can get darn near any medication. I mean, all you got to do, for any of you who've ever been down to San Diego, you can just skip across the border to Tijuana and get all kind of drugs and medications, but you might end up growing, an extra ear or tail or something, but in the United States, we have a process.
Ilaria from social media says there are several policies regarding the spacing between the vaccine doses in different countries. For example, in the UK, they give the second dose after nearly 3 months. Here in the USA, we are given the second dose after 21 days. And CDC has said that the second dose may be given until 42 days. So why these policies seems to be different from each other, although the vaccine is the same? Is there a specific recommended time? And how much protection normally does the vaccinated person get after the first dose?
The most practical response to that is all of these guidelines for the vaccines are just that. They are guidelines, okay? As we said earlier, we still don't know enough to really say anything definitively. All we have is the scientists in that region of the world, what they think based upon what they know. So it is all relative. A great deal of science deals with statistics or biostatistics, okay? So there are not too many times we're going to say something definitively. Even the rule about 6 feet apart, everyone says, oh, stay 6 feet apart. Well, that's relative, okay? Because if you have a woman who is 5'0" versus a man who is, 6'5", the lung capacity, the physiology of their lung capacities are totally different. And so that big guy, 6 feet apart may not be enough for him. He may need 10 feet, okay? And that smaller woman, she may only need 4 feet. Also, if you're working out in a gym, which I tell people stop going to the gym right now, it's not safe. Because if you're breathing hard, what's coming out of your mouth or your nose is gonna go further, but that's if you're not wearing a mask. That's why it's so important to wear the mask. So all of that stuff, it's relative. So in terms of how long a certain vaccine will take to elicit the immune response that we want, it is relative. Okay, they try to give a general guideline that encompasses most people based on the clinical trials, but it's all relative. Now, if you want to take the time to go in a few weeks or so and get an antibody test to see where you stand, I mean, that's up to you if you want to go through that. But my thing is, once you've been fully vaccinated, I still encourage you to continue to wear your mask and socially distance for several months beyond that. Just continue to do that. Just to give your body time to completely settle into what you may have. Like I said, we still don't know if the vaccines provide protection against transmissibility. So, that's, we just have to be patient.
What is actually in the vaccine?
Components that elicit, I'm not going to get into all the technicality or into the microbiology, but the vaccines contain components, component materials that stimulate the immune system. It gives material that the immune system, it gives genetic material that the immune system recognizes. If you think about the mRNA vaccine, I'm getting a little bit into that, I didn't want to, but if you think about the mRNA vaccine by Moderna and by Pfizer, mRNA stands for messenger RNA. Okay, it is simply a messenger. It's in the nuclear cell of the body, and so basically the mRNA delivers the message from the DNA. It takes the message from the DNA. It's a messenger. That's why it's called mRNA. It takes the message from the DNA and tells the body to create cells to do this, to do that. Okay, so that genetic material is enough for the immune system to recognize the virus the virus that causes COVID-19. All right, the virus that causes COVID-19. So that genetic material is enough that the immune system recognizes it and starts to form antibodies. The antibodies, those are the little soldiers that protect you, okay? Not just from COVID-19, but from all kinds of things, just from the common flu sometimes. So that's the basic answer to what's in the vaccines. And different vaccines take different routes of how they are created. So that's why, certain vaccines, if they are grown inside eggs or so. If you have an allergic reaction to certain things, you should not take certain vaccines. So, you know, the basic answer is that there's small things inside the vaccine that causes a response. That's what you want. It causes your soldiers to go to battle for you.
Thank you for joining us for Let's Talk COVID-19. For more information, please be sure to watch the other videos in this series and visit the Leroy Jefferson Medical Society website.